So what is the ideal dose? I think you mentioned walking before, and then the ideal type of exercise.
So if we're coming from the metabolic piece, from the glucose and insulin signaling, what we know is that kind of what we would call chronic cardio or steady state cardio, just going for an easy jog every single day, doesn't actually do much from a glucose and insulin lowering perspective, but doing some of the variable heart rate training, so high intensity interval training where maybe you do maybe a couple sprints, or maybe you're not a runner, you're protecting your joints, you're going to do it in a different way, but you can, do something where you're getting your heart rate up and then letting your heart rate come down and doing a few repeats. That actually has been shown to be much more beneficial from a metabolism standpoint. So I usually say, walking after a meal is great. Especially in diabetics or especially people who are incorporating any kind of carbohydrate in their diet, because the muscle movement will help pull glucose in without the need for insulin. So it's a little bit more of an optimizing that insulin piece, but then increasing that glycogen depletion with that high intensity stuff. Again, more room for glucose to go, improving insulin sensitivity. And the other is always resistance training. So if we can put stress both on our bones, right? If we're lifting heavy, we're putting more weight on our bones. So especially for our women who are postmenopausal, increasing risk of osteopenia as we get our thinning bones, weightlifting, putting weight improves or helps your bones maintain density or improve density. And then if we increase our muscle density, not only is muscle density and muscle volume, so lean mass, associated with lower cancer, it's associated with better outcomes in cancer. Why? Well, do we have more glycogen storage? So not only, and our muscles, then we burn more of that sugar as we need to. So again, we know that people who increase muscle mass improve metabolic health too. So from a metabolic perspective, I usually recommend 2 to 3 days of HIIT, 2 to 3 days of lifting, or a combination thereof. Some people do their lifting in a HIIT fashion. So I'm not really, and I say, in the studies, I think they compared 30 minutes of chronic cardio or steady state cardio to 12 minutes of HIIT. Like you can do it in like everybody can do a little bit of HIIT, and you don't have to be mobile. So some patients, right, they're not going to get up and do a bunch of jumping jacks and push-ups and burpees and whatever, but there's a lot that we can do in varying intensities, or levels of fitness where we still are focusing on those primary principles.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
This is your body saying, hey, I finally had to throw down this really big, scary word at you so that you would stop and listen, so that you would stop and look. And so now let's just work to see what is